Thank you for joining the Society of Thoracic Surgeons webinar series in preparation for the June 2018 Fly-In. This briefing will provide background information to help you to engage with members of Congress and their staff during your upcoming trip to D.C. My name is Courtney Yohe. I'm Director of Government Relations for STS. Along with my colleagues in the STS Washington, D.C. office, Amanda Wiegriff, our Assistant Director, Nick Beek, Political Affairs and Advocacy Manager, and Madeleine Stirling, Government Relations Coordinator, I want to thank you for signing up to participate in the upcoming STS Legislative Fly-In. I hope you will find this a rewarding and educational experience, and that you will gain tools today that will help you to develop relationships with your congressional representatives that will serve you and STS for many years to come. Before we get started with the advocacy briefing, let's take a quick look at the schedule for the Fly-In. Monday night we will all get together for dinner. We'll have time to address any questions you may have, and the next day you'll come back to 20 F Street for a light breakfast at 8 a.m. before spending the day on Capitol Hill. We will provide you with a personal schedule with all of your Hill meetings when you arrive. Over the course of these webinars, you will hear from several STS members along with STS staff. Together, we will walk you through the following topics: the current climate on Capitol Hill, the STS Political Action Committee and advocacy resources, including how they impact policymaking on the federal level, and our legislative asks for your meetings on Capitol Hill. Given how volatile our political environment can be these days, I'm sure many of you are interested in what you'll be facing when you arrive. Despite the exciting headlines and political drama you may see in the news, this month is likely to be fairly quiet. The last stunning display of bipartisan action came earlier this year when Congress passed the Bipartisan Budget Act of 2018. This bill included many wins for STS and the cardiothoracic surgery specialty, including the following. Language was stricken from the bill that would have targeted the identification of misvalued codes to cut Medicare physician payment across the board. The Physician-Focused Payment Model Technical Advisory Committee is now allowed to provide technical assistance to sponsors of alternative payment models, or APMs. STS pushed for this change so that the Society can continue its work developing alternative payment models for cardiothoracic surgeons. The National Quality Forum was funded for the next 2 years, and a pathway to secure stable funding for the Agency for Healthcare Research and Quality has opened up. Medicare will now cover life-saving home infusion therapies, and changes to the macro statute made it easier for physicians to avoid penalties in the early years of the MIPS program, before CMS is ready to implement them. These victories are huge, but there's always more work to be done for the specialty. Unfortunately, as the midterm elections this November approach, the prospect of major legislation passing decreases. However, movement on the opioid epidemic is realistic in the House of Representatives. Both the House Ways and Means Committee and the House Energy and Commerce Committee have voted on opioid legislation, and it is likely that the full House of Representatives could vote on legislation before the August recess. At this time, the pathway for Senate passage of major opioids legislation is unclear, but we do expect some movement this year. Most pundits expect that Democrats will pick up seats in the House of Representatives this November, and many speculate that the House of Representatives will flip to Democratic control. It is more likely that Republicans will hold on to the Senate. However, some pundits speculate that the control of the Senate is also in play. Because Republicans, who stand to lose the majority, currently control the congressional calendars, we can expect them to spend as much time as possible campaigning at home in their districts rather than legislating in Washington. Beyond wins in the budget deal, STS remains confident that major improvements can be made to the healthcare system. This slide provides an overview of some of the advocacy successes STS has helped to achieve in the past several years. STS had big wins on TAVR, getting lung cancer screening covered by both private insurance and Medicare, SGR repeal, and preventing the elimination of both global surgical payments and crucial research funding that many STS members rely on. Many of you attending this fly-in discussed these issues with your representatives and senators at earlier fly-ins or back home in district meetings. These efforts tend to have long-term horizons and often require constant diligence. They aren't always flashy pieces of legislation to celebrate. Sometimes victory means CMS leaving something out of a final rule. But I think that everyone would agree that the results are well worth the work. Now I'm going to turn things over to Nick Beek, our Political Affairs and Advocacy Manager, who will talk to you about the political arm of STS advocacy, STS-PAC.
Thanks, Courtney. The composition of Congress matters when it comes to drafting effective public policy. It is important to ensure that the physician community at large, and cardiothoracic surgeons specifically, are both represented and heard by Congress. STS-PAC works towards that end. As the political arm of the Society of Thoracic Surgeons, the PAC, or Political Action Committee, allows cardiothoracic surgeons to participate in politics and make STS's voices heard. The PAC supports physicians and other allies of our specialty as they run for Congress. The PAC exclusively supports candidates for federal office and does not get involved in presidential or state elections. STS-PAC has raised over $3 million from politically active STS members since its creation in 1997. This chart shows how much STS-PAC has raised by 2-year election cycles. In 2018, STS-PAC has raised over $80,000 and is on track to outraise the previous 2 years. This map shows where STS-PAC contributions came from in 2017. STS-PAC supporters come from all parts of the country. If you'd like to contribute or learn more, you can do so at sts.org/PAC.
Thank you, Nick. I'm Madeleine Stirling, the STS Government Relations Coordinator, and I'm going to talk about a few other ways to get involved in advocacy. Contributing to the PAC is one way to be an advocate, as is attending a fly-in. Hosting a site visit is another great opportunity to forge a personal connection with your member of Congress. We will arrange all the details, and you get to run the show, educating your representative with a hands-on and lasting experience that works with your schedule. Of course, please use the STS Advocacy website as a resource. You can sign up to be a key contact, stay abreast of developing policy issues, contribute to the PAC, contact representatives and senators, and more. Many of you attending the fly-in are key contacts. If you're not already an STS key contact, it's easy to sign up online. Key contacts are cardiothoracic surgeons on the front lines of advocacy efforts throughout the year, committing to at least one advocacy activity per year, and are our go-to team of advocates with specialty. Key contacts are the face of STS relations with Congress. We also encourage you to follow advocacy developments through our various email newsletters and publications, like STS Advocacy Monthly. Each month we publish quotes, photos, and announcements from and by key contacts in the Advocacy Monthly section Key Contact Connect. Keep an eye out for your name in the next issue. Check-up with Congress calls are another great way to stay involved and speak to members of Congress. More information on our next call will be coming soon. Finally, please be sure to follow STS Advocacy on Facebook and Twitter. If you have any questions regarding the upcoming fly-in or anything to do with politics and policy, please do not hesitate to contact the STS Washington staff. We very much appreciate you taking the time to familiarize yourself with these issues. Now, let's move on to the legislative asks that we're hoping you will take to your representatives on the Hill. Just like it sounds, the ask is the main thing you're requesting that your member of Congress do for you. It could be as simple as weighing in with another member of Congress or signing a letter. In other cases, your ask may be to co-sponsor a piece of legislation. There are 5 asks this year, which is too many to cover in any one meeting. It's up to you to decide which asks resonate with you and what you'd like to talk about with your congressional offices. We will let you know if your member of Congress has already indicated that they're on board with something, so you don't spend time on a topic unnecessarily. You'll be guided through these issues by a number of STS members, many of whom are members of the Workforce on Health Policy, Reform, and Advocacy. Dr. Ali Khan Naji will talk about graduate medical education reform. Raymond Strobel will present information about price transparency initiatives in Congress and how they impact the Society's efforts to access Medicare claims data. Dr. Madeleine Daniel will discuss a bill that encourages research and prevention of lung cancer in women, and Dr. Paula Ginnip provides an overview of PCORI and the upcoming funding battle. Finally, Dr. Eric Sarin will go over why an oral health initiative is important to cardiothoracic surgeons and their patients. Please click on the next webinar to get started. We hope you enjoyed the educational webinars, and we look forward to seeing you in Washington, D.C.